Hey everybody, Dr. Rafich here from Vet Triage. It is Friday, January 10th, 2025, 3:22 p.m. Pacific Time. We are going through about halfway now, Veterinary Surgery Journal, with its October 2024 edition, and we are talking about the feasibility of open cholangioscopy with disposable flexible endoscopes. So, open meaning that we make an incision in the abdominal cavity and open it up. Cholangioscopy is using a scope to evaluate the gallbladder, and disposable flexible endoscopes. Obviously, disposable you don't reuse them. Flexible, they can move as opposed to rigid, which are stuck in one shape. And endoscopy, of course, is using those fiber optic cables to look down into viscera. This comes out of Cornell University, where I graduated. Objective: to determine the feasibility of an open cholangioscopy using disposable flexible endoscopes in canine cadavers. Ex vivo experimental cadaver study, 8 dogs. They weighed 5.8 to 43.8 kilograms. They underwent open transcholecystic cholangioscopy. So transcholecystic means that they opened up the gallbladder and then went through the gallbladder lumen and into the cystic duct. They used disposable flexible endoscopes. They reached the most distal anatomic region, which was of the biliary tree towards the duodenal papilla, and that was visualized with the endoscope and then recorded. And you can see down there in the picture below, that's one example. That's actually in cats for what the normal anatomy will be like. There are variations between dogs and cats, and even between individuals, but in general, just so you know what kind of anatomic structures we're talking about here, we're going to be talking about gallbladder, cystic duct, hepatic ducts, and common bile ducts, as well as the major duodenal papilla. Those are all in the picture. Results: a disposable flexible endoscope was feasible for visualization of the junction of the common bile duct, cystic duct, and hepatic ducts in all 8 dogs. The use of certain endoscopic tools can be considered through the disposable flexible endoscope, although fluid installation was affected. So normally, if you're going to pass instruments through this scope, the scope has to be large enough and then the instruments have to be small enough to go through them. That way you can collect samples and things like that. Conclusion: 3.8 millimeter disposable flexible endoscope could be placed through an open transcholecystic approach to provide intraluminal endoscopic evaluation up to the level of the junction of the common bile duct, cystic duct, and hepatic ducts. So notice there in the drawing. And these are in dogs without cholesystic disease. This is a low-cost diagnostic and therapeutic tool in cases of obstructive biliary disease up to the level of the common bile duct. Introduction: direct endoscopic evaluation of the biliary system through cholangioscopy and or choledocoscopy in humans has been used diagnostically and therapeutically, including the evaluation of obstructive biliary disease, targeted endoscopic biliary biopsies, stenting of biliary strictures, and minimally invasive choledocolith removal. So just to give you some definitions here: choledocoscopy, chole means gallbladder, DOCH, which is the doc part, that's biliary, the biliary ducts. And then scopy is scopings. And then a choledocolith is a stone that's found either in the gallbladder, the biliary duct, or both. These interventions are often performed in conjunction with peroral endoscopic retrograde pancreaticocholangiography. So peroral means through the mouth, endoscopic means using endoscopy, retrograde means flexing the scope to go up a different path, and pancreatocholangiography is injection of dye into the pancreatic and gallbladder ducts. You need specialized experience and equipment. Endoscopic evaluation of the extrahepatic biliary system through cholangioscopy or choledocoscopy with clinical applications has rarely been reported in canine veterinary literature. Other surgical options include cholecystotomy, cholecystectomy, choledocotomy, biliary rerouting like a cholecystoenterostomy, and or biliary stenting through a duodenotomy, though more minimally invasive laparoscopic and cholangiographic interventions have been reported. Let's go over those terms. Cholecystotomy means that you're opening the gallbladder. Cholecystectomy means you're removing the gallbladder. Choledochotomy means that you're opening up the biliary duct. Biliary rerouting techniques like cholecystoenterostomy. There's two types of cholecystoenterostomies. There's cholecystojejunectomy and cholecystoduodenotomy, and that's the rerouting of the gallbladder to the small intestine. So obviously one is to the jejunum, or one could be to the duodenum. Patency assessment can be performed through cholangiography, cholangioscopy, and choledocoscopy. Purpose-made choledocoscopes require significant upfront expense of $50,000, and there's a concern for patient-to-patient infections. Disposable scopes cost about $2,300 for 4 disposable endoscopes. Disposable scopes require less ancillary equipment, as a light source is already embedded in the scope, and a single unit is required for processing and display, about a $5,500 expense. Transcholecystic cholangioscopy can be used for hepatobiliary interventions, especially for establishing patency of the biliary tree before performing a cholecystectomy and targeted biliary biopsies. Documentation and removal of choleliths via flushing or basket retrieval avoids the need for a choledochotomy or a choledostomy procedure. Materials and methods. For the open transcholecystic cholangioscopy procedure, the gallbladder was dissected free from the hepatic fossa. They aspirated the gallbladder contents. They placed a vascular dilator 9-2 French sheath over a guide wire, and then in the event that you wanted to perform a cholangiography, the vascular dilator could be exchanged for an angiographic catheter to perform an intraoperative cholangiogram at this stage of the procedure, and then they use a disposable flexible endoscope. So this is the open approach. So you can see there, A is the exteriorization of the gallbladder, B is they place a purse string in the gallbladder, C is them emptying out the gallbladder contents, and then D, E is passing the vascular sheath there into the gallbladder. And then here is an image of what they're seeing with the scope right there. Boom. Hepatic duct is B, and then the common bile duct is A. Results. Descriptive data. The median weight was 27.6 kilograms, median age 11 years, most were mixed breed dogs. Regarding disposable flexible endoscope, at the level of the confluence of cystic, common bile, and hepatic ducts, further advancement of the scope was restricted because of the diameter of the scope and the flexure created between cystic duct and common bile duct. In 3 out of 8 cases, entry of hepatic ducts were seen along the course of the cystic duct. That's pretty cool. So you can see there in the drawing, as they're passing down the cystic duct, you can see some of the hepatic ducts branching off. And then using the 1.9 flexible endoscope, they passed retrograde into hepatic ducts to evaluate secondary intrahepatic ducts, as well as antegrade down the common bile ducts to the level of the major duodenal papilla. So it's pretty cool. Okay, and here's another image here. This is, A is the common bile duct, and then B is the hepatic ducts, so pretty wild. All right, discussion. It's a pretty straightforward paper. Oh, here, before we go into that, here are some more images. There you go. So this down here is they're using forceps, that's the metal tool, to biopsy the biliary duct. And then over here is the passing of the tools into the scope. And then here are all the images you can see of different ducts. Okay. The startup cost of a disposable endoscope is estimated to be $6,100. It costs $575 per scope, and $5,500 of the cost being allocated to processing and display unit. Startup costs for other scopes in this study are estimated to be $75,000 to $100,000, which is about $15,000 to $20,000 for the Flex XC alone, with the associated scope tower costing $60,000 to $80,000. Human per oral cholangioscopy startup costs are around $50,000 to $90,000. Biliary surgical rerouting or surgical stenting can have significant, possibly fatal complications including anastomotic dehiscence, meaning leaking from the surgery site, leading to bile peritonitis, chronic cholangiohepatitis, and strictures. A transcolocystic approach was chosen over a transcolodocal approach because of the ability to convert to a biliary rerouting procedure more easily and or cholecystectomy pending diagnostic findings. In all cases, the junction between the cystic duct and common bile duct and hepatic ducts were visualized. However, distal visualization of the biliary tree was limited by the disparity in outer diameter of the disposable flexible scope, with the average diameter of the common bile duct at the level of the porta hepatis, as well as the flexure created between the cystic duct and common bile duct. Standard common bile duct diameters in humans are reported to be 4 to 6 millimeters in healthy adults, determined by ultrasound and echo endoscopy. Thus, standardly used cholangioscopes have an outer diameter of less than 4 millimeters squared for people. The diameter of a normal bile duct in healthy dogs is 2 to 4 millimeters. A recent study using ultrasound and CT scan reported the diameter of the common bile duct in normal beagle dogs at different locations of the biliary tree to be a mean of 4.6 millimeters in ultrasound to 5.06 on CT at the level of the gallbladder, 2.09 millimeters on CT to 2.6 millimeters on ultrasound at the level of the porta hepatis, and 2.59 millimeters on ultrasound to 2.75 millimeters on CT at the level of the duodenal papilla. The mean diameter of the bile ducts in dogs suspected to have cholecystatic disease in the previously mentioned study had significantly higher sizes at the level of the porta hepatis, 4.3 millimeters, and duodenal papilla was 4.42 millimeters, meaning that the diseased dogs have obviously dilated ducts. Diseased biliary tract and gallbladder tissue may be prone to tearing or rupture. Therefore, caution should be exercised when manipulating the tissues. Many patients with hepatobiliary disease have concurrent biliary tract dilation, typically 4 to 5 millimeters in diameter, which was not present in this study, but may allow for more complete investigation of the common bile duct with scoping. Most cholecystic and obstructive biliary diseases occur primarily in small breed dogs, typically less than 15 kilograms. Lastly, in a specific subset of patients affected by gallbladder mucoceles, significant gallbladder necrosis or intra-gallbladder sludge could prevent adequate visualization and manipulation of the gallbladder. Yes, my only criticism really, again, we always want more animals, so more cadavers would be good. And then I was wondering why they didn't use bigger dogs for this study. Bigger dogs would have larger size anatomy, but they're right, most of this disease happens in smaller animals, so they wanted to show it can be done in slightly smaller dogs. All right, everybody, thanks so much. We'll be back again tomorrow for another one. Please subscribe, hit like, do all the things. We'll talk to you soon. Bye.